أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Ladies and gentlemen, you are very welcome today for this talk. We will talk about the psychological interventions for weight management, and we'll try to cover the three objectives as shown here. The first one would be recognize the importance of psychological interventions for the overweight. Then we'll move on to identify the psychological barriers to health behavior change and maintenance. Then we'll try to discuss the behavioral, the cognitive, the social, and emotional variables that are conceptualized as barriers to lose weight or weight management. We'll see and during this talk, inshallah, what we will start with. As you see right now here, as you see this triangle, thoughts, behavior, emotions, we are talking about cognitive behavioral therapy, which is highly evidence-based and recommended for weight management and short-term or long-term, in particular about what we will do about case formulation with individual cases. So the first one, or the first item, which is really important, we have to highlight it, which is goal setting. When we got some patients like couldn't even try to specify what his goal and what is BMI and what he would like to obtain. This is a huge concern with these goals, and when we try to see some patients couldn't actually even identify his goal or without goal even, then we can see the self-monitoring, which is as well another technique and really important before and after the intervention. I mean, sometimes we use it even after bariatric surgery, for example, or without bariatric surgery. We will use it in both ways. For example, we try to agree with our patients that we have to weigh ourselves once a week or once each 10 days. It is really important to build on his own or her own chart to see the weight. And then the next visit, we'll try to discuss this chart with the patient to try to discuss what's going on. So the chart is going up or going down, the weight going up or going down, and we try to see and figure out what's the reason and why both ways going up or going down. Then the stimulus control, we try to identify, as I said, case formulation, try to ask the patient what they can motivate him to overeat, for example, or what sometimes to find out if there's any barriers to motivate him to walk or to increase his physical activity as well. This is really important when you try to find out what's the stimulations with all these patients. It's really important. Then we can build a plan, interventional plan to control all the stimulations. We'll try as well to find out how this alternative can create really important role with this patient. Try to ask the patients to create a list of alternative activities. For example, it is essential that these activities are realistic, don't require excessive resources, and are valued as well. To try to discuss this concern with the patient, what he can do. For example, if I came to one of the client and I ask him, so please, you have to walk 300 minutes per week. And I don't know about if there's any knees pain, back pains, or he has a medical or physical health concern, couldn't obtain these 300 minutes. So we have to discuss what he can do. For example, what's the alternative if he have any sport equipment at home? And if there is any good social support for him as well, to find any other alternative. If he can start with 10 minutes, that's good. So I couldn't say, no, it is not our goal. So I would encourage this patient to start with even the minimum 10 minutes, 15 minutes. Then next visit, I can discuss if he can increase it 5 minutes, 10 minutes. So if he do anything as minimum, we can start with. Then we can talk about the cognitive restructuring, as we see the triangle emotions, behaviors, and thoughts. So what our rules here is trying to identify and challenging the thoughts, attitudes, which is really important, as you see the beliefs that undermine one's weight management goals. And unhelpful thoughts or beliefs called cognitive errors. And in particular with Arab cultures or the local cultures, it's really important, the social pressure and the food, how we can it's play major role in our life. It related with emotions. Most people here, for example, how they communicate together and how they can express their emotions about or with other people's by food. So you're eating this amount of food. That means a lot to others. It means you like my food, you like my hostility, you like what I'm doing, and it is shame if I couldn't eat anything from your food. So all of these unhelpful thoughts, it's a barrier to make any control or management. In particular, I couldn't ask the patient or the client to isolate himself from the community or from the social or from the people or from the family gathering or any activities, family activities, I mean. So what we try to do to have this patient support to identify all these challenging, in particular between couples. I mean, for example, the wife and husband within the small family, and try to change their own lifestyle at home, starting with the minimum what we can do with trying to identify, first of all the cognitive errors related with food or eating. This is another technique or another approach, trying as well to practice it with all these patients. And I put here just one example. This is a program for 8 weeks called Mindful-Based Stress Reduction for June Capital. So this is a really good program, but it is not, I can practice it with all the clients or all the patients, so you can find out what's the best as well for your patient, which is really important. The idea about the mindfulness is to live the present and live the future at the moment, and regardless what related with this situation. Imagine with me that if you couldn't practice the mindfulness your own self, so how you can practice it with your clients or with your patient. It's really important to make self practice. Then you can start it with one of your patients. It's really important. And for example, what I'm trying to tackle or highlight in this concern, what we call it eating mindfulness. I mean, for example, if I ask the patient to just make 10 to 20 chewing in just once, try to enjoy this this chewing when each spoon food, which is really important. And here's this, it helped the patient to try to decrease and increase the time with the major meals. I mean, for example, with lunch should be stayed 30 minutes at least. So this is really important to make any mindfulness. and make sure this patient not finishing his main meal like lunch in just 1 or 2 or 5 minutes. So this is really important. We'll call it, we'll try to tackle this point when emotional eating. Here's another technique as well, which is called it motivational interviewing, which is communication styles and trying to understand the motivation, which plays a role in behavioral change. And motivation and self-determination have been proposed as mechanism that may play a role in long-term maintenance of weight management, which is really important. For example, when we try to ask the patient what's the advantage and what's the disadvantage and why you would like to change. Are there any really important reasons you would like you to change? So I will play the role of discovering the patient's own reasons to change, not my own reason, which is really important to make different with all your patients. And try to practice the autonomy. So it means we have to discuss all the options and make a list of choices for the patient according what he suggests as well, which is really important, with all respect as well. This is really important and evidence-based for 40 years ago, and it's become a worldwide technique and style. We can use it even and not just in mental health care providers, as well with all healthcare providers, in particular primary healthcare, nutrition, and related with weight management. For example, when we talk about the other approach, which is related with, for example, the behavioral activation. So this is type of technique. We can use it to try to increase the physical activation with the patient. So we can make another list with the patient. So what he or she can do, any physical activity, he can enjoy it. For example, swimming, walking in a mall, or any type of physical activity at home. So this is really important. Then, as we see, the ACT, which is acceptance and commitment therapy, which is, I would highly recommend to use it with a patient still live in denial, and he thinks or she thinks there is no problem with him or with her, which is really important. So then try to discuss all these concerns with your patient, try to find where's the problem. Not according of my perspective, but it is from the patient perspective. As well, the second part here, as we see, the commitment, which is really important, which is related with relapses after or starting the weight management, which is really important. When we can see it after, for example, a few weeks of starting weight management or losing a few kgs, it's really important. Psychotherapy as well, it is really important to use it when we talk about some concerns related with weight management with patients who are suffering from any eating disorders or any type of mental illness like anxiety or depression or body dysmorphic disorder, which is really important concept in mental disorders, which is really important to solve it and discuss it before starting any weight or any obesity or any weight management, which is really important to solve all these issues before starting to put any program or any try to ask the patient any commitment, any practicing any plan you would like to start. Another simple technique, it might be some patients, easy to teach these patients this technique, relaxing relaxation training, which is really important, as you know, the breath relaxation, and sometimes muscle progressive relaxation. But highly recommend, I would like to start with deep breath relaxation, and I call it 4-4-8 technique. 4-4-8 technique, when you start to have your breath with 4 count, 1, 2, 3, 4, then you hold your breath for 1, 2, 3, 4, then try to exhale your breath and 8, 1, 2, until 8. So the idea behind this technique is to try to teach the patient these skills to breathe slowly. Hypnotherapy as well, another technique here, but there is no need to hypnotherapist around. But yes, it is one of the technique. We can use it even online, but this is one of the options which is as well evidence-based these days. The control emotional eating, which is really important, and one important concept for all who deals with any weight management with your patients. So trying to ask some questions for example, when you ask your patient when you eat, when you feel hungry or angry, for example, which is very important, and try to identify which type of food he eating related with one concept of emotions, happiness or sadness or angry or stress or fear or anxiety. So it might be related with eating. We call it emotional eating. Actually, it might be not a disorder, but yes, it is not a disorder. But one significant concern we have to discuss it and try to manage it as well. It might be 50% of the population might be suffering of emotional eating, as shown in one paper. But yes, it is manageable. We can call it. It might be need a behavioral modification for 3 months. Sometimes we need 6 months, sometimes less or more, according to the patient motivation. But we have to rule out any emotional eating with our patients. So the main question here, for example, we can ask, what's your role as a psychologist? How you can help within the team? And related with weight management, if we rule out all the concept of mental illness or mental disorders like eating disorders or binging disorders or any body dysmorphic disorders, then we'll move on to continue, for example, with emotional eating and behavioral modification with lifestyle. And trying to move and implement healthier or healthy lifestyle, try to identify all the concepts or all the cognitive, all the ideas, all the beliefs related with food and why he's gaining weight. So make sure the reasons beyond the obesity is the psychological. It might be it's not a genetic, it might be not a social pressure, it might be lifestyle. So it's the emotional or psychological type. We try to help and facilitate all these concerns with our patient. As well, an assessment to identify a psychological pathology or psychopathology concept, which is really important. Try to find out if there is any primary psychopathology like any serious mental illness like psychosis or severe depression or any suicidal thoughts, any mental illness, make any dysfunction like distress or personal, psychological, social dysfunction. It's really important to make comprehensive psychological assessment. Although identifying silent triggers beyond the obesity. If we clear there is no physical reasons for the obesity, it might be there is really silent triggers. I mean, something beyond psychological or beliefs or cognitive or feeling as well. Trying to have history from childhood. What's the concept about the body shape as well? As well, trying to understand signals and comments that typify struggle and distress. All the emotional make any dysfunction to continue or to change lifestyle. Then try, it might be we can just enough for one visit, two visit, then no need to follow up. It might be no, some patients need to make any follow up. For example, or if we identify any psychopathologic concept with any patient, might be needs at least between 6 to 12 sessions, more or less according the assessment what we need to make. Might be regular session weekly, every 2 weeks, or sometimes monthly, but make sure there is no any contraindications or any significant psychopathology. Our final slides, as you see, and it might be we have bigger question. It might be you ask what's the which type of psychological intervention you consider it is the best. Actually, there is no the best technique, but there is evidence-based. What I prefer always, I will choose motivational interviewing, cognitive behavioral therapy, according the psychological assessment and evaluation. I can sometimes recommend techniques for any colleagues in the teamwork. Professionals can be trained in certain elements of all these techniques, don't worry. So sometimes you don't need to refer this case for psychologist or psychiatrist if there is no major mental illness. I mean, if you can deal with emotional eating, for example, such as you need try to find social support for this patient, to teach the patient goal setting, self-monitoring, and other self-regulatory techniques, all of which have been proven to be effective. Also, it is important to avoid projective language about body mass and fat, which is illicit feeling of weight stigmatization. Managing one's weight can be very stressful, and interventions that help clients to cope effectively with this strain would be helpful. I hope you enjoyed this talk for today, and thank you very much. If there is any question, please don't hesitate to share all your feedback or comments. Thank you very much for today.